Hello, student. Today topic of lecture, the veins of systemic circulation. First question, the system of vena cava inferior, the vein jugular vein, the sinus of the dura mater, the vein flow into vena jugularis, the subclavian vein, the veins of the upper extremities, and next question, the azygos and inferior vena hemiazygos. You know that blood is transported in the tube system made of blood vessels. The blood vessel system occurs macroscopically as a tubular network of arteries and veins, which is distributed through the body. The naming of the blood flow in relation to the heart. The arteries transport blood from the heart to the periphery of the body or lungs, and veins transport blood from the periphery of the body back to the heart. All arteries carry veins transport blood from the periphery of the body and the lungs back to the heart. Most veins are concomitant to arteries. They run parallel to corresponding arteries, accompanying veins. The cause of veins is much more versatile than that of arteries and can show great individual variation. However, the large vein stems occur regularly in all people. Veins, together with capillaries and venules, belong to the low pressure system of the blood circulation. Science in the upright position most veins which support the venous return flow. They ensure that the blood flow is only possible in direction of the heart. The vein of systemic circulation divided into three systems. The system of vena cava superior, this is vein of head and neck and upper limb. The system vena cava inferior, this is vena pelvis and veins of lower extremities. And third system, the system of vena cava inferior. This is three system. System vena cava superior, system vena cava inferior, and system of portal vein. So, the system of vena cava superior. Vena cava superior. Vena cava superior is 5-6 centimeter long and forms to the right of the spine behind the sternocostal joint through unification of the vena brachiocephalica dextra et sinistra. On entering the pericardium of the right side, the azygos vein flows into the height of the fifth thoracic vertebra. The vena cava superior, and vena brachiocephalica have not valves. The veins brachiocephalica originate in the vena jugularis interna, and the vena subclavia, vena jugularis interna and vena subclavia. In the region and in the venous angle, which is placed directly behind the sternoclavicular joint and have very different trajectories of the side, on other side, as a side. On the right, vein is short and merges almost vertically into the superior vena cava. On the left, on the other hand, the vein traverses the branches of the aortic arch and trachea practically horizontally and includes two unpart vessels. Arteria thyroidea inferior, and vena hemiazygos accessoria. Bilaterally, the following are conjoined: vena vertebralis, vena thoracica interna, vena intercostalis suprema. What you see, this is vena cava inferior, vena brachiocephalica right, and brachiocephalica left. What you see? Vena cava superior, vena brachiocephalica right, vena brachiocephalica left. This is, you see, aorta, heart. Right and left brachiocephalic vein. From the vena cava, this is right and the left from the vena cava superior on the level of the cartilage of the right first rib. Each brachiocephalic vein are formed by the edges of the subclavian and internal jugular vein and vena subclavia and vena jugularis. The right brachiocephalic vein just 2-3 centimeters in length. It's shorter than the left. The left brachiocephalic vein is about twice the length of the right. Veins thyroidea inferior and vena thyroidea ima. Originating from the dense venous plexus edge, lower edge of the thyroid gland. This is, you see, thyroid gland. This is thyroidea, vena thyroidea inferior, vena thyroidea ima. The veins of thymus drain into brachiocephalic vein. Right and left brachiocephalic vein. The internal jugular vein, what you see, this is vena jugularis, vena subclavia, vena brachiocephalica, right. This is vena cava inferior. This is venous angle, right. Venous angle, right. The internal jugular vein, vena jugularis interna, carries blood from the cavity of the skull and the organ neck. Beginning at the foramen jugular, where it forms a distension, the bulbus superior vena jugularis interna. The vein passes downward laterally of the carotid, arteria carotis interna, and further laterally of carotis communis. Second distension, the bulbus inferior vena jugularis interna, is formed at the lower end of vena jugularis interna before it joined vena subclavia. This is vena jugularis interna has two bulbus superior and bulbus inferior. Bulbus superior, bulbus inferior. Vena jugularis interna. is a continuation of the sigmoid sinus of the dura mater. This is, you see, sinuses of skull, blood color. Dura mater contains several reservoirs collecting blood from the brain. This is our sinus, what you see, sinus of dura mater, sinus dura matrix. What this is, you see, sinus. The sinus are venous canals, triangular on transverse section, devoid of the valves and located in the thickness of dura mater. What you see, dura mater forms sinus of dura mater. This is sinus. They differ from veins in structure of their walls, which are composed of tightly stretched layer of dura mater. The inflexibility of the wall of the venous sinuses provides free drainage of venous blood in changes of intracranial pressure. This is important for uninterrupted activity of the brain, which explains why such venous sinuses are present only in the skull. This is, you see, bone of cranium. This is dura mater. What you see, dura mater. This is sinuses. What you see, dura mater. This is, you see, sinuses. This is fold of dura mater. This is sinuses. Falx cerebri. This is cavity. The sinuses are as follows. What you see, sinuses scheme. This is first sinuses, sinus transversus, or sinus transversus. What do you see? Sinus transversus. The largest and widest sinus, which runs along the posterior margin of the tentorium cerebelli in the sulcus sinus, transverse of the occipital bone. From here, it descends into the sulcus sinus sigmoideus. This is sigmoid sinus. And the jugular. And at the jugular foramen is continuous with the orifice of the internal jugular vein. jugular vein. As a result, the transverse and sigmoid sinus, transverse and sigmoid sinus form the main receptacle for all the venous blood of the cranial cavity. All other sinus drain into either directly or indirectly. This is, you see, this is sinus transversus, continuation into sinus sigmoideus, and open into foramen jugularis, where begins vena jugularis interna. Next sinus, the following sinus drain into sigmoid sinus sigmoideus. Next sinus, the superior sagittal sinus, sinus sagittalis superior, sinus sagittalis superior. On the upper margin of the falx cerebri for the whole length of sulcus sinus sagittalis superioris from crista galli to the internal occipital protuberance. On either side of the superior sagittal sinus, within the dura mater are located the so-called blood lacuna, which are small cavities communicating with the sinus and the diploic veins on the one side and with vein of the dura mater and brain on other. This is, you see, sinus sagittalis superior, sinus sagittalis superior. Next sinus, the occipital sinus, sinus occipitalis. Sinus occipitalis is a continuation of superior sagittal sinus along the attachment of falx cerebelli to the internal occipital crest, then after bifurcating along both margin of the foramen magnum of the occipital bone. This is sinus occipitalis. Next sinus rectalis. Sinus rectalis. Oh, do you see sinus rectalis? Sinus rectalis runs on the line of attachment of falx cerebri to tentorium cerebelli. It receives anteriorly the inferior sagittal sinus, sagittal sinus inferior, stretching on the free lower margin of the falx cerebri and vena cerebri magna. Вот you see magna, vena magna cerebri. This is sinus rectus, sinus rectus, sinus rectalis, and sinus sagittalis inferior. and vena cerebri magna, carrying blood from the deep part of the brain. This is plexus venosus, drain into sinus rectus. This is sinus sagittalis, drain into sinus rectus. Next, at the confluence of this sinus transversa, superior sagittal, straight and occipital, a common expansion forms. It called the confluence of the sinuses, confluence sinu, or torsular heterotrophy. This is confluence sinuses. Next sinus, sinus cavernosum. Is located on the base of the skull lateral to the sella turcica. It has the appearance of a venous plexus or white lacuna surrounding the internal carotid artery. It's connected with similar sinus of the other side by means of two transverse communication. Intercavernosus sinus, sinus intercavernosus passing in front of the and behind hypophyseal fossa, as a consequence of which a venous circle form in region of sella turcica. The cavernosus sinus is an intricate anatomical complex whose component, in addition to the sinus itself, are the internal carotid artery, the nerves and connective tissue surrounding them. The cavernosus sinus receives anteriorly the superior ophthalmic vein, passing through the superior orbital fissure, as well as the inferior end of the sphenoparietal sinus, sinus sphenoparietalis, This is arteria ophthalmica. This is sinus sphenoparietal running off the margin of the ala parva. This is sinus cavernosus. the cavernosus sinus is drained of blood by two sinuses located behind it. Namely the inferior superior petrosal sinus, sinus petrosus superior, sinus petrosus superior, and sinus petrosus inferior, located superior, which they located in this is sinus petrosus superior and sinus petrosus inferior, located in sulcus petrosa superior, sulcus petrosus inferior. This is pyramid. Sinuses inferior and superior petrosal sinus connect cavernosus sinus with sinus transversus and sinus marginalis, located around foramen magnum. Both petrosal sinus communicate by means of several venous canales, which lie within the dura mater on the basal part of the occipital bone, and they united under the term plexus basilaris. This plexus is connected with venous plexuses of vertebral canal, into which blood from the cranial cavity flows. Into sinuses drain venous blood from brain. Blood drains from the sinus mainly into the internal jugular veins, but the sinus are also connected with the vein of the outer surface of the skull through emissary vein. Emissary vein. Vena emissaria, transmitted through opening of the skull bones, foramen parietale, located in the bone, foramen parietale, foramen mastoideum, canalis candilaris. Small veins leaving the skull together with nerves through foramen ovale, from foramen ovale, foramen rotundum, and canalis hypoglossus, and canalis hypoglossus play a similar role. What you see parietal foramen parietalis for passes vena emissaria. This is bone parietalis. This is, you see, sinus in sagittal. This is the blood drain into, what you see, sagittal sinus. This is passes into foramen jugularis and form vena jugularis interna. Vena jugularis interna. This is, you see, sinus sagittal superior. This is sagittal, sinus sagittal sagittalis inferior. This is, you see, transverse sagittal. And you see vena emissaria. What you see, vena emissaria. Vena emissaria. This is bone, substance of the bone of the cranial. This is, for example, parietalis. This is, you see, vena emissaria. Connect vein of the skin with sinus sagittal superior. No, and you see vein diploica. Vein diploica. Next, diploic veins and veins of the spongy substance of the cranial bones also drain into sinuses of the dura mater, while the other end may be connected with the veins of the external surface of the head. The vena diploica are canals anastomosing with one other and lined by a layer of endothelium. They pass in the spongy substance of the flat cranial bones. Now this you see canals of vein diploic. This is what you see. This is vena emissaria, connect vein of the skin outer and with sinuses, and diploic connect vein into bone. This is vein, vena diploica, vena emissaria. Vena diploica, emissaria. This is vein connect with sinus of the cranial bone. Now what you see, diploic vein. What vena diploica? Vena diploica, veins, diploica. This is occipital and temporal vein. This is vein, parietal vein. This is frontal bone. This is, you see, diploic vein. Diploic vein. Vena ophthalmica superior and inferior collect blood from the orbital cavity, and drain into sinus cavernosus. Vena ophthalmica, superior and inferior. Collect blood in sinus cavernosus. What do you see? This is sinuses. The following veins flow into vena jugularis interna. First vein, the facial vein, vena facialis. What you see? Vena facialis. Draw into vena jugularis interna. Passes under musculus styloideus and musculus sternocleidomastoideus. Next vein, retromandibularis. Vein retromandibularis. Collect blood from the temporal region. Further down, a trunk carry blood out of the plexus pterygoideus. Between musculus pterygoideus drains into vein retromandibularis, after which the vein passing through the thickness of the parotid gland with the external carotid artery merges with vena facialis below the angle of the lower maxilla. Vena anastomotica facialis connect with pterygoid plexus. It is situated at the level of alveolar margin of the lower maxilla. It connects the superficial and deep veins of the face. The anastomotic vein may spread infection, which may be of importance in practice. Next vein, vena pharyngealis. Form plexus on the pharynx and flow as a directly into vena jugularis. Interna or empty into vena facialis. This is what you see, vena facialis, This is vein. Next vein, vena thyroideum, vena thyroidea superior, vena thyroidea superior. Collect blood from the upper part of the thyroid gland, and the larynx. This is vena jugularis interna. Next, vena thyroidea media. Vena thyroidea media. Arise from the lateral edge of the thyroid gland and drain into vena jugularis interna. At the lower margin of the thyroid gland there is an unpart venous plexus thyroideus impar, which drains through the vena thyroidea superior. Into vena jugularis interna, and also through vena thyroidea inferioris and vena thyroidea ima, into the veins of the middle mediastinum. What you see, this is vein. This is artery and vein. Vena facialis and vena facialis. This vein is absent. You see, this is vena jugularis interna, subclavia. This is, you see, vena jugularis externa, interna, externa, brachiocephalic. Next vein, vena jugularis externa. Originate behind the flow of auricle of image at the level of the maxilla angle, from the region behind the mandibular fossa. From here, from there it descends into subcutaneous tissue covered by musculus platysma and travels along the external surface of the sternocleidomastoideus muscle. Crossing is obliquely downward and posteriorly. On reaching the posterior edge of the sternocleidomastoid muscle, the vein enters the subclavicular region, where it immediately descends and drains into subclavian vein, usually in a common trunk with vena jugularis anterior. Behind the floor of the auricle, vena auricularis posterior and vena occipitalis drain into vena jugularis externa. Vena occipitalis and vena auricularis. This you see only vena occipitalis. Drain into vena externa, vena jugularis externa. Next vein, vena jugularis anterior. Vena jugularis anterior. Vena jugularis anterior is made up of small branches located over the hyoid bone, from which point it descends. Both the right and left anterior jugular vein perforate the deep fasciae coli propria, enter the sputum intraperitonicum, intraaponeuroticum suprasternalis, and drain into the subclavian vein. In the suprasternal space, the anterior jugular veins anastomoses with either one or two trunks. This venous arch, arcus venosus juguli, is formed over the top edge of the sternum and the clavicles. In some cases, the right and the left veins are replaced by a single unpart vein, vena jugularis anterior. Which descends along the medial line and drain below into the venous arch form. In such instances, by the anastomosis between vena jugularis externa, right and left. This is vena jugularis anterior, anastomosis to vein, right and left, vena jugularis externa. Well, this is form anastomosis. What you see? Veins, internal and external jugular veins. External vein, vena jugularis externa, vena jugularis externa. what you see fragment of vena jugularis interna. This is externa and interna. And you see it is vena jugularis anterior, next you see internal and external jugular vein. What do you see? What you видите, this is a vein, vena jugularis externa. Vena what you see vena jugularis interna, this is you see externa. Next, the subclavian vein. The subclavian vein. The subclavian vein is direct continuation vena axillaris. It located below and to the front of subclavian artery, from which it separated by musculus calenus anterior, behind the sternoclavicular joint. The subclavian vein matches with vena jugularis interna. The major creates vena brachiocephalica. Vena brachiocephalica. This is, you see, vena subclavia vein. Vena, what you see, vena jugularis interna, vena brachiocephalica sinistra. This is vena subclavia. This is angle, venous angle sinistra. What you see, this is vena jugularis interna. This is vein, fascial vein. You see fascial vein. you see vein jugularis anterior. Next question, the veins of the upper extremity. The veins of the upper extremity are divided into deep and superficial vein. The superficial or subcutaneous vein anastomose to form a widely looped network which is in places has larger trunks. These trunks are the following: the vena cephalica. What do you see? Vena cephalica. Arise from the radial side of the forearm. It reaches the elbow where it anastomoses with the basilic vein, vena basilica. And then ascendance along the sulcus bicipitalis, lateralis up to trigonum, deltoid pectorale. Weight perforates the fascia and drain into vena axillaris. This is, you see, cephalic vein, vena cephalica, vena basilica. Vena basilica originates on the ulna side of the dorsal reta of the hand and passes to medial segment of the anterior surface of the foramen along musculus flexor carpi ulnaris to the ulnar flexion. There are it anastomoses with vena cephalica through the vena mediana cubiti. Then it settles into the sulcus bicipitalis medialis, perforates the fascia in the middle of the arm and drain into vena brachialis. Vena cephalica drain into vena axillaris. This is vena cephalica drain into vena brachialis. Vein cephalica located in bicipitalis medialis lateralis, vena basilica located in sulcus bicipitalis medialis. Next vein, Vena mediana cubiti. Vena mediana cubiti is an obliquely positioned anastomosis connecting vena basilica and vena cephalica in region of the elbow. It usually receive blood from vena mediana antebrachium. Vena mediana antebrachium. Carried from the palmar side of the hand and forearm. The median cubiti, vena mediana cubiti is imported in practice as a site of intravenous injection and blood transfusion. Blood for laboratory test is also collected here. This is from vena mediana cubiti. You see, this is vena cephalica, this is vena basilica, vena mediana cubiti. Variant. This is vena cephalica. This is vena basilica. This is vena mediana basilica connect with mediana cephalica. And to form what media this is, and this is what vena mediana antebrachium. Blood in the vessels drain into two veins, vena mediana cephalica and vena mediana basilica. This is vena mediana cubiti. This is absent. And this is variant. And you see vena basilica vena mediana cubiti. This is vena cubiti medialis, vena cubiti medialis. This is vena cephalica. Vena cephalica, vena basilica. This is vena mediana cubiti, vena basilica, vena mediana cubiti, vena cephalica. Next, deep veins. Deep veins attend arteries of the same name, usually two veins for every artery. Thus, there are two brachial, two ulnar, two radial, and two interosseal veins. This is axillary vein. This is axillary vein. Both brachial vein joined at the lower edge, musculus pectoralis major, and form the axillary vein, which passes medially and anteriorly of the artery of the same name of the axillary fossa, covering in patella, passing under clavicle. It continues further as vena subclavia. vena subclavia. What axillary vein? What you see? Axillary vein. Axillary vein. Then subclavian vein. Axillary vein. What you see? Axillary vein. This is cephalic vein. Cephalic vein. And this is subclavian. What cephalic vein drain into vena axillaris. Vena axillaris. This is vena basilica drain into vena brachialis. This is vena brachialis. Besides vena cephalica, acromiothoracic vein, это thoracoacromialis, vena thoracoacromialis. Beside vena cephalica, this is vena cephalica, vena acromialis, thoracoacromialis, corresponding to arteria thoracoacromialis. Arteria thoracoacromialis. Lateral thoracic vein, vena thoracica lateralis, correspond artery thoracolateralis. Thoracolateralis. Arteria vena thoracica lateralis. Into which vena thoracoepigastrica, large trunk of the abdominal wall. As drain, subscapular vein, vena subscapularis. But if you subscapular arteria subscapularis accompanies artery, vein, vena subscapularis. If you vein circumflexa humeri, corresponding arteria circumflexa humeri. What do you see? Axillary vein. This is vena thoracoepigastrica. Vena thoracoepigastrica. Vein. next vena azygos and inferior vena hemiazygos. Vena azygos and vena hemiazygos. Vena azygos and inferior vena azygos. Inferior vena azygos. Inferior vena hemiazygos. What hemiazygos form in abdominal cavity out of ascending lumbar vein. Ascending lumbar veins which connect the lumbar vein. Which connect the lumbar vein longitudinally. They pass upward behind musculus psoas major and make their way into the thoracic cavity between the muscular bundles of diaphragm's crus, vena azygos, with right venous splanchnicus, splanchicus and vena hemiazygos with the left nerve splanchnicus or sympathetic trunk. This is arteria vena azygos and vena azygos and vena hemiazygos. In the thoracic cavity, vena azygos rise along the right lateral side of the spinal column, closely adhering to the posterior wall of the esophagus. At the level of fourth or fifth vertebra, it departs from the spine and behind over the root of right lung, drain into vena cava superior. Besides, the branches carrying blood from the organs of mediastinum, 9 right inferior intercostal vein, and through them the veins of vertebral plexus into drain into the Anpat vein. Near the place where the Anpat vein bends over the root of right lung, it receives blood from the vena intercostalis superior dextra, created by the merger of 3 right superior intercostal vein. Vena hemiazygos lies over the left lateral surface of vertebral bodies behind the descending to thoracic aorta. It ascends only up to 7th or 8th thoracic vertebra, then turns right, and passing obliquely upward over the anterior surface of the vertebral column behind the thoracic aorta, and ductus thoracicus drain into vena azygos. То есть vena hemiazygos drain into vena azygos. It receives branches from the organs of the mediastinum and lower left intercostal veins as well as veins of the vertebral plexus. The upper left intercostal veins drain into vena azygos accessoria. Vena azygos accessoria, which runs from top the bottom, arranging itself just as vena hemiazygos. This is vena hemiazygos accessory drain into vena hemiazygos. On the left lateral surface of the vertebral bodies, the drains either into vena hemiazygos or directly into vena azygos, bending to right over the anterior surface of the seventh thoracic vertebral body. This is vena azygos drain into vena cava superior, vena hemiazygos drain into vena hemiazygos into vena azygos, vena hemiazygos accessory drain into vena azygos. Together, blood from two veins drain into vena azygos. Vena azygos drain into vena cava inferior. Today, and now I finish lecture. Continuous lecture in next day. Goodbye, student. Thank you very much for attention.